Thank you, Tori, for that information. I'll now take you through how to implement our resource into practice and the knowledge to action framework and how this has influenced the development of our resource. The resource provides information on how best to create achievable, appropriate, and evidence-based goals that are centered to the client's individual needs. It is important for new graduate speech pathologists and speech pathologists unfamiliar in AAC to refer to this pamphlet when goal setting. This pamphlet provides key information that can facilitate the discussion between the client, family members, and the clinician. By identifying the key aspects, such as making sure goals are client-centered, involving the client's key communication partner, targeting the client's needs to an impairment and participation level, and ensuring their goals are created using a SMART format. This will enable the best outcomes for implementation and continued use of AAC. New graduate speech pathologists may have limited to no experience in AAC. This pamphlet additionally provides further detail on how to access support, such as find a mentor through the Speech Pathology Australia website. These programs can aid in providing information from experienced speech pathologists in AAC. In addition, speech pathologists can access more information through Scope and Neurella, as well as seeking out clinical evidence through systematic searches. Given the varied nature of clientele with complex communication needs who rely on AAC, it is extremely difficult to provide examples of goals. Each client has very individual and varying levels of receptive and expressive language, resulting in the need for a clinician to be very adaptable when identifying AAC goals for communication needs. The Knowledge to Action Framework is a framework created by Graham et al., which outlines the steps that need to be taken by clinicians to implement knowledge into practice. The central idea of the framework is for clinicians to be able to collect the most relevant and recent research in a specific area, synthesize this information, and then use it in practice. For example, it is pertinent that clinicians working with clients with complex communication needs requiring AAC to be up to date with all emerging evidence about the implementation and creation of client-centered functional goals. The framework encourages clinicians to identify a gap in their knowledge and then review evidence related to this gap. Speech Pathology Australia's clinical practice guidelines on AAC make various reference to a lack of knowledge and understanding of AAC services for some clinicians, particularly new graduates. Our resource was developed based on this knowledge put forward by Speech Pathology Australia's clinical practice guidelines on AAC, and we have attempted to remedy the gap by creating a resource that provides guidelines based on evidence for practicing speech pathologists. Clinicians then need to identify relevant evidence in the area and ensure knowledge is adaptable to a local context. For example, the resource we have created provides new graduates or clinicians unfamiliar with AAC with one succinct guideline on how to set functional, client-centered goals. This was underpinned by Speech Pathology Australia's suggestion that many speech pathologists lack knowledge, and especially in new graduates, in the AAC service provision. The next step, according to the Knowledge to Action framework, is to look at the barriers and facilitators of implementing this evidence into practice. For example, is it viable to use specific methods suggested in research with your client, or are there barriers that will affect this? When working in AAC, access and opportunity barriers outlined in the participation model are one of the main considerations for clinicians when setting goals and implementing these goals in practice. These barriers are clearly documented in the resource we have created in terms of developing functional goals. Clinicians are encouraged to look at the client's surroundings and create goals to suit. Once practicalities have been considered, clinicians need to select and tailor interventions to ensure relevance to their specific client. Again, this process is encouraged by our resource as clinicians are taken through the process of developing functional goals in terms of differing evidence-based models of practice such as ICF and participation model. Once ideas have been adapted to be suitable for implementation, they need to be monitored to assess how successful they are. In developing our resource, it was identified that all aspects of the ICF and the participation model are relevant when selecting outcome measures and ensuring that these outcome measures are relevant to the client. Clinicians are encouraged in our resource to use the ICF as well as other models to determine and monitor outcome measures. To help assess how successful implementation has been, it is vital to evaluate outcomes. This means ensuring goals can be adapted to the ever-changing needs and wants of your client when outcomes are not being met. Furthermore, clinicians need to continually identify gaps in their knowledge to ensure the most accurate evidence-based practice is being used. We hope this resource provides new graduates with the information they need when first starting out with clients with AAC. Thank you.